Trigger finger, also known as Stenosing Tenosynovitis, is a condition that affects the tendons in the fingers or thumbs, causing them to become inflamed and making it difficult to move the affected digit smoothly. This condition is characterized by a sensation of the finger catching or locking in a bent position, followed by a sudden release or trigger that causes it to snap straight, often with a popping or clicking sound. The anatomy behind trigger finger involves the flexor tendons that are responsible for bending your fingers. These tendons pass through a series of pulleys in a sheath within the finger. When the tendon becomes irritated or inflamed, it thickens and cannot glide smoothly through the sheath. This causes the tendon to catch, which results in the locking or popping sensation. The condition typically starts with mild discomfort or pain at the base of the affected finger, often accompanied by stiffness, swelling, or tenderness. Over time, the finger may become more difficult to straighten or bend. In severe cases, the finger may remain in a bent position and need to be manually straightened. This is often a source of frustration and may limit hand function, especially if it affects the dominant hand. Causes and risk factors. Trigger finger is more likely to occur in individuals who perform repetitive gripping movements or heavy lifting, as these actions can put strain on the tendons. Certain medical conditions increase the risk of developing trigger finger, such as diabetes. People with diabetes are more likely to develop trigger finger, possibly due to changes in tendon tissue and reduced blood flow to the area. Rheumatoid arthritis. This autoimmune disease can cause inflammation in the tendons, increasing the risk of developing trigger finger. Age and gender. The condition is more common in people over 40, especially women. This may be due to hormonal factors or general wear and tear over time. Trauma or injury. A direct injury to the hand or repetitive stress can lead to tendon damage, making trigger finger more likely. Symptoms. The hallmark symptoms of trigger finger include pain or tenderness at the base of the affected finger or thumb, especially when making a fist or gripping. Swelling in the affected area, often around the palm or finger joint. Stiffness that makes it difficult to straighten the finger, a sensation of the finger catching or locking, which may occur with a sudden snap or click. Limited mobility, with the finger or thumb potentially getting stuck in a bent position, sometimes requiring manual assistance to straighten. Diagnosis. A healthcare provider will typically diagnose trigger finger based on your medical history, symptoms, and a physical exam. They may palpate the finger to feel for tenderness or swelling in the affected tendon and ask about any repetitive activities or underlying medical conditions that could be contributing to the issue. In some cases, imaging tests like an X-ray or ultrasound may be used to rule out other conditions or assess the extent of the tendon damage.